Joining me now for more on all this is Dr. Robert L. Zarr, President of Physicians for a National Health Program. Dr. Zarr, welcome.
Thank you for having me.
Great to have you with us. I keynoted your organization's conference in, I think, '99, some long time ago. It was in Seattle, as I recall, or maybe San Francisco. No, it was San Francisco.
Slightly before my time.
Yeah, it's a great group. First of all, any thoughts on this so-called new Republican plan to replace Obamacare?
Well, I think a good place for us to start, frankly, is to have a little bit of talk about the difference between ACA and improved and expanded Medicare. I think there's a lot of misconception and misunderstanding about ACA. And I would say that really the biggest difference to me as a practicing pediatrician and now as president of Physicians for a National Health Program is that HR 676, or single payer national health insurance, it would provide every American with comprehensive, lifetime, quality, and affordable health care.
Right. And it does that basically by expanding Medicaid, or Medicare rather. We already have a single payer system in the United States. We call it Medicare. Why not just make that available to everybody, right?
Well, that's right. So Medicaid and Medicare were established in 1965. The difference is that Medicare is for all Americans age 65 and up. Right. And it's a pretty comprehensive program, and it's gotten better over the years, except for the privatization of Medicare through the Medicare Advantage plans that we've been seeing.
Right.
But I think many Americans still don't quite understand what it means to have health insurance. Yeah. And I think that's where we find a lot of the deficiencies in ACA.
Right. Because it's running through these large corporations, these basically they're banksters. I mean, you know, Stephen Hemsley, the CEO of United Healthcare, has taken over $1 billion in compensation over the last decade. His predecessor, Bill McGuire, called him Dollar Bill. He took $1.7 billion to be the head of a health insurance company. I mean, they didn't give a single vaccination to a single child. All they do is handle money. It's
for example, when I say all Americans, right, improved and expanded Medicare for all, I really mean all Americans. Yeah. And ACA, for example, currently we still have 42 million Americans without health insurance. Right. And that doesn't even count for the around 50 million that are seriously underinsured. Right. So it's only with a system that's publicly funded, that creates a national health insurance fund, that's progressively funded through tax money, that's going to get us the quality and the comprehensive benefit package at a price that everybody can afford.
So 4 years ago, 3-4 years ago, I forget the year of the election in Vermont when Peter Shumlin became governor, but he had been a senator. In fact, I think he might have been the Speaker of the Senate or the head of the Senate in Vermont. And he campaigned on a platform of, I will sign a single-payer health care bill in the state of Vermont. And all the Democrats in the legislature campaigned on that. They got elected. They passed the law. They forwarded it to him. He created a commission to come up with a plan for how do we fund this, how do we put it into place. And then a few months ago, he pulled the plug on it. What's going on in Vermont, and how does that inform our national conversation?
Well, I remember actually being on Diane Ream's show on a panel, and the governor was actually on that panel as well. And I said then, and I'll say again today, that the plan put forward in Vermont wasn't exactly single payer. For it to be single payer, you have to have a large enough population of people on the same plan. So it's sort of a multi-payer, really, than a single-payer plan. And then there were other pieces in Vermont. For example, the monies that were supposed to go to the expansion of Medicaid, not all those monies got to the state of Vermont. A lot of money, millions of dollars, was spent just to put up the exchanges. Can you imagine how much primary care, which is what I do for a living, could have been provided with all that money that's spent on the bureaucracies, the private bureaucracies, just to run an exchange?
So is the Vermont single-payer plan still relying on for-profit health insurance companies?
Well, I would say this. In part, yes, right? In part, yes, because the exchanges are based off of the idea that you will purchase a privately insured plan.
Right.
So, and in true single-payer, and I would say probably the best example of that for me would be in Taiwan, where you see every Taiwanese has the same insurance card, They have freedom to go to any doctor, any hospital, any pharmacy, and it's a very, very comprehensive benefit package. So it includes the acute care and the chronic care and the long-term care, rehabilitation, habilitative care, on and on. Everything is covered. So in a country like Taiwan, and we should see that in a country like the U.S., there should be a cessation of bankruptcy due to not paying your medical bills.
Right.
And that's never going to happen unless we make it affordable. And to make it affordable, every American has to be on it. And there's no simpler way to do that than to expand Medicare and improve it.
Well, Robert S. Ball was one of the guys who wrote the original Medicare bill, for Lyndon Johnson. And toward the end of his life, he released some of the paperwork from back then, and he went on the record and said, when we put into place Medicare, our plan was Medicare would be out there for a few years, maybe a decade, and then we would start lowering the eligibility age by a decade every 2 or 3 years. It would take 2 or 3 years for the federal bureaucracy to be able to catch up with another decade worth, of people, and that, within 20, 25 years, everybody in America would be covered by Medicare. And he was just unambiguous about this, and he said Lyndon Johnson believed this too. I mean, they had this conversation in the White House. Where did that go wrong? How did that get derailed? Or was it just that, after the Ronald Reagan record album and its socialism, and someday we'll look back on this as the moment when freedom went to hell? Did that just put a stop to it?
Well, I think there's been a lot of change, certainly in the medical profession, since 1965.
Right.
And there's also been a lot of change in medical technology and in the way we deliver health care since 1965.
Right.
So, for example, the drug benefit didn't exist until very recently in Medicare. So the percentage of expenditures, your own expenditures, if you were above the age 65 at that time for medicines, was quite low. It's quite high now, right? Due to the lack of regulation for the prices of medicines.
Or lack of competition.
So yeah, even when Medicare, the Part D was passed, there was a moment there where you could take 50 million Americans who were on the rolls of Medicare, and the government could have essentially bargain the price of medicines down to a reasonable level. Right. And we didn't do that.
Well, Billy Towson had to go on to his $2 million a year job as the head of the lobbying firm for pharma.
Yeah. I might also add that physicians today have been polled, and there's a couple of scientific research that has been published, and it's looked at the opinion among physicians in a 5-year span. And it's clear that the majority of American physicians support the creation of national health insurance. So it's not really a fighting issue among the physicians now.
Yeah, and I think among anybody who's ever traveled outside the United States or been, of the 34 OECD countries, we are the only one, to the best of my knowledge, where you can go bankrupt if you get sick. That's nuts. Wouldn't the best way to end up with this goal be to have a public option, have that public option be Medicare, have people have the ability to buy into Medicare? The administrative costs of Medicare are 2-3%. Administrative costs for these big health insurance for-profit corporations are 15-20%. Prices are going to be lower. Everybody would end up there, wouldn't they?
Well, I would say the fastest way to solve this problem is to take a bill like H.R. 676, right, Improved and Expanded Medicare, and pass it into law. And the reason I say that is because we can try a state-to-state approach. We can try by deciles, decreasing by deciles, taking Medicare and letting people get into the Medicare roll. But we're talking about a giant gap right now, and a huge chasm. You can't jump this except in one huge leap. And that's what's going to get us where we need to get.
Okay, so everybody get out there, promote single payer.
Please, thank you so much.
Yeah, Dr. Zarr, thank you so much for being with us tonight.